Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about this comment that was left on one of my most recent videos. And this video is basically about why we don't do more scans than what is medically necessary in a pregnancy. We like to limit it to about 2 to 3 in a normal, healthy pregnancy. And what this commenter was saying is that when it is medically necessary, as in when the pregnancy is high risk or there are complications, then there are no risks to having more scans, yet when you get elective scans, then there are risks. Now, I really would like to clear this up for everybody by saying that the effects or the potential effects, or I guess the dangers of potential effects, are all the same. Doesn't matter if you're high risk, doesn't matter if you have a normal, healthy pregnancy, all the exposure from the ultrasound is going to be the same. Hopefully that is pretty obvious, and it's not just because you get more scans because you're high risk, all of a sudden there is no risk to ultrasound. But I think it is important to note that when you are high risk, like let's say you have gestational diabetes, or let's say you have some sort of placental insufficiency, the risk that we are taking with exposing baby and mom to more ultrasound is definitely going to be more beneficial, as in the benefits are going to outweigh the risks of the ultrasound. The benefit of monitoring the pregnancy closely to ensure that nothing is going to go wrong in a very short amount of time, and to make sure that it is still okay for baby to be inside of mom instead of being outside of mom, and weighing out if or when early delivery needs to happen. All of those things that we can tell from having ultrasounds in high risk pregnancies is definitely going to be more beneficial, and basically it's going to be worth the risk of exposing baby and mom to more ultrasound than not. Now, on the other side of things, and basically the point that I was trying to get at in my other video, is that when we go and get entertainment scans or scans that are not medically necessary in a normal, healthy pregnancy, then that is where there is this gray area of it being not really beneficial necessarily for the pregnancy, because again, in a normal healthy pregnancy, you really shouldn't need more than 2 to 3 scans. And then we start looking at, okay, well, we are exposing mom and baby to more ultrasound, which overall, if we are looking at things, there are still risks to ultrasound. We know that ultrasound does heat up tissue to some degree. And yes, in the way that we have been using ultrasound and only ordering ultrasounds when it is medically necessary, there have been no proven side effects. So technically, we can say that ultrasound is safe for the way that we use it. But at the same time, you do have to also understand that at the end of the day, we don't know exactly what the long term effects are and exactly where to draw that line of when the risks start to outweigh the benefits. So, again, when we are dealing with a normal, healthy pregnancy, that's why we always limit ultrasound exposure, because in the end, we don't actually really know the effects of ultrasound. And although nothing has been shown yet with the way that we use ultrasound as something that is dangerous or that there are side effects, it is still just something that we don't actually really know about, because large long term studies have not been done. And also, there is that ethical factor as well for these studies to take into consideration, too. So I guess the be all end all is that the exposure is all the same. But when you are high risk and when we do need to monitor the pregnancy closer than what a normal healthy pregnancy would be needing, then the benefits of having regular ultrasounds do outweigh the risks. But we also want to limit exposure as much as possible. The ALERA principle, which stands for as low as reasonably achievable, is basically one of the main rules that we try and follow with ultrasound, as in we try and get our images with the lowest power possible as well in the shortest amount of time to, again, minimize any possible side effects there are for the patient. And when we are really not sure about what the long term side effects are for ultrasound, we do just want to go ahead and limit that exposure if it is not necessary and if it is not going to provide proven medical benefits for the patient.